I would like to show you this figure, very, very important. The circle, the outer and the inner. This is a total self. Someone's, mine, yours, total self. The big circle represents the total self, our full human personality. The inner and outer. Inside this, there is a conceptual ego, the sense I, that organizes your experiences. After understanding this, the total self and the inner self, let's concentrate here on the egoism. The small curved arrows at the top show egoism, these ones. A movement of energy turned inwards towards self-interest here. So egoism, addictions are done for one's own benefit. If the ego gets dissociated, cut off from the whole self, like here, it becomes a mere ego. Meaning it lives in isolation, focused only on itself, not the greater reality. This is danger of unchecked egoism, self-centeredness. So if someone is here, it is just mere ego. But if someone goes out of this self, but still it is for his inner side, this is egoism. So this is ego, this is egoism, but it is centered towards inside. Then altruism. A small outward arrow represents altruism, this one. The ego extending itself towards others. It is still a function of the ego. We know it starts from here, since it is intentional action from the self, but now oriented outward. Here it is originated from itself and it is both a bidirectional. This is one directional, helping others. In simple terms, the ego is not dissolved, but redirected towards serving others. Then comes the compassion. The thick downward arrow labeled compassion is much longer and stronger. It represents a deeper force of the total self. Beyond just the ego. Compassion flows from the whole person, not just the ego, and connecting one's being to others, suffering in a more profound way. That's why it is shown as descending directly from the core of the self, not from the outer edge, just like this. So egoism is from the outer edge, from the ego sense. Altruism is from the inside, but outwards. Compassion, you feel, you see, you notice, you feel, and then you respond. So the key message of the diagram is egoism is the ego looped back on itself, self-interest. Altruism is the ego reaching outward but still ego-based, this one. While compassion is deeper, more fundamental than ego, it comes from the total self. If the ego dissociates from the whole, like this, it becomes mere ego. But when the ego is integrated into the total self, compassion arises naturally and altruism becomes authentic. So, in simple words or in plain words, the diagram is showing that compassion is not just another function of the ego, like egoism or altruism. Instead, it is rooted in the total self, transcending the ego, and when it flows through, it purifies the ego, making altruism possible in its true sense. Egoism is acting in one's own self-interest, while altruism is the unselfish concern for others, well-being, often a personal cost. Compassion is an emotion, that a quality that derives both altruistic and self-compassionate actions, involving a deeper empathetic connection that can shift focus from self-centered concerns to the broader well-being of others. These concepts represent different motivations for behavior, with altruism and compassion being seen as positive pro-social behaviors that benefit others. So the caring with compassion means empathy, where it's interest, listening and head, sympathy, warmth, kindness and heart, and altruism, care, actions and hands. The tension between egoism and altruism in healthcare professionals often face the challenge of balancing egoism and altruism daily. On one hand, they must consider their interests, such as personal safety and professional boundaries. On the other hand, they are committed to promoting the health and well-being of their patients, even when it involves personal sacrifice. Navigating this ethical landscape requires empathy, self-awareness, and a strong personal and professional growth commitment. So, striking a balance, building a more compassionate society, a society that values egoism and altruism, fosters personal growth while promoting a culture of compassion and support. By understanding the role of egoism and altruism in healthcare, we can create more empathetic and informed healthcare policies, build healthier communities, and foster greater well-being for all. So, in conclusion, egoism and altruism represent two sides of human experience, each shaping our motivations, actions, and moral reasoning. By exploring these concepts through a healthcare lens, we can better understand the factors influencing patient care and ethical decision making. Ultimately, acknowledging the importance of both egoism and altruism can help us build a more balanced, empathetic, and compassionate society. So the frequently asked question